Your 4 moments for hand hygiene. Version 1.1. Acknowledgement. The Ministry of Health and Long-Term Care would like thank the WHO World Alliance for Patient Safety for sharing its Clean Care is Safer Care materials. This presentation includes slides from Annex 16 and concepts from the Observer's Manual of Clean Care is Safer Care, the WHO Multimodal Hand Hygiene Improvement Strategy developed by the World Alliance for Patient Safety. Ontario congratulates WHO on the clearly articulated concept of 5 moments to perform hand hygiene. Ontario has done a local adaptation of the 5 moments concept and will be teaching your 4 moments for hand hygiene. The 4 moments include 6 indications for hand hygiene. Instructions for trainers. This presentation should be used by trainers to teach healthcare providers and observers the essential moments for hand hygiene using the 4 moments for hand hygiene concept. Healthcare providers include all who work with patients or in the patient care unit. Trainers are encouraged to add slides to provide local context by including local compliance rates and local data on healthcare-associated infections. Trainers may also wish to include slides from the science behind Just Clean Your Hands presentation to supplement content. During the session, the discussion and healthcare provider participation should be stimulated as much as possible in order to achieve an optimal understanding of the key messages. The presentation can be given in a single session of approximately 45 minutes or split up into shorter sessions covering one of each of the 4 moments for hand hygiene. Public Health Ontario offers online learning in infection prevention and control. For hand hygiene, review the IPAC Core Competencies course, specifically the Healthcare Provider Controls module. Performing hand hygiene, when and how overview. 1 discussion of 2 environments for hand hygiene and the impact on transmission of organisms. 2 review of 2 methods for cleaning hands and the importance of technique in reducing the spread of infections and maintaining skin integrity. 3 practical training for healthcare providers on the essential moments for hand hygiene. Your 4 moments for hand hygiene. 4 a high-level overview of the observational audit process. Did you know? Healthcare-associated infections, HI, are the most common serious complication of hospitalization. 1 in 9 patients admitted to Canadian hospitals acquire an infection as a consequence of their hospital stay. In Canada, it has been estimated that 220,000 incidents of HI occur each year, resulting in more than 8,000 deaths. Zoutman et al. 2003. 8,000 deaths/year is approximately the same as the number of deaths from breast cancer and motor vehicle accidents/year. Healthcare-associated infections were the 11th leading cause of death 2 decades ago, but are now the 4th leading cause of death for Canadians, behind cancer, heart disease, and stroke. An increase in hand hygiene adherence of only 20% results in a 40% reduction in the rate of healthcare-associated infections. McGeer, A. Hand Hygiene by Habit. Infection Prevention, Practical Tips for Physicians to Improve Hand Hygiene. Ontario Medical Review, November 2007, 74. Did you know? Most healthcare providers believe they are already practicing good hand hygiene. The observational audits from the Just Clean Your Hands testing in Ontario showed a baseline general compliance rate of *. The pilot study also showed that compliance rates must be broken down into each moment and by the type of healthcare provider to ensure reliable comparative data. The power to make a difference is in your hands. Why does perception and practice differ? Healthcare providers generally clean their hands when they are visibly soiled, sticky or gritty, or for personal hygiene purposes, e.g. after using the toilet. Usually these indications require hand washing with soap and water. This habit is frequently learned in early childhood. Other hand hygiene indications unique to healthcare settings are not triggered by the habit to clean the hands. Highlighting these indications in healthcare are needed to create new habits. Examples of actions in healthcare that do not naturally trigger a need to clean hands include touching a client, taking a pulse or blood pressure, or touching the environment. This type of hand hygiene is frequently missed in healthcare settings. Hand hygiene in healthcare. Healthcare providers move from patient to patient and room to room while providing care and working in the patient care environment. This movement while carrying out tasks and procedures provides many opportunities for the transmission of organisms on hands. Transmission of organisms. Transmission of organisms by hands of healthcare providers between two patients can result in healthcare-associated infections, HIEs. Why does hand hygiene work? Hand hygiene with alcohol-based hand rub, correctly applied, kills organisms in seconds. Hand hygiene with soap and water, done correctly, removes organisms. How to clean hands, 2 methods. 2 ways to clean hands. Alcohol-based hand rub is the preferred method for cleaning hands. It is better than washing hands, even with antibacterial soap, when hands are not visibly soiled. Hand washing with soap and running water must be done when hands are visibly soiled. If running water is not available, use moistened towelettes to remove the visible soil, followed by alcohol-based hand rub. Technique matters. It is important that skin on hands remain intact to reduce the spread of organisms. To clean hands properly, rub all parts of the hands with an alcohol-based hand rub or soap and running water. Pay special attention to fingertips, between fingers, backs of hands and base of the thumbs. Keep nails short and clean. Remove rings and bracelets. Do not wear artificial nails. Remove chipped nail polish. Make sure that sleeves are pushed up and do not get wet. Clean hands for a minimum of 15 seconds. Dry hands thoroughly. Apply lotion to hands frequently. Activity, view training DVD, main menu, techniques. When should hand hygiene be performed? Before preparing, handling, serving, or eating food. After personal body functions. Before putting on and after taking off gloves. Whenever a healthcare provider is in doubt about the necessity for doing so. While all indications for hand hygiene are important, there are some essential moments in healthcare settings where the risk of transmission is greatest and hand hygiene must be performed. This concept is what your 4 moments for hand hygiene is all about. 2 different environments. Healthcare environment. Patient environment. Environment beyond the patient's immediate area. In a single room, this is outside the room. In a multiple room, this is everything outside of the patient's bed area. This is the patient's area. In a single room, this is everything in the patient's room. In a multiple room, this is everything in immediate proximity to the patient. Point of care, the right way, in the right place. Busy healthcare providers need access to hand hygiene products where patient/patient environment contact is taking place. This enables healthcare providers to quickly and easily fulfill the 4 moments for hand hygiene. Providing alcohol-based hand rub at the point of care, example within arm's reach, is an important system support to improve hand hygiene. Point of care refers to the place where 3 elements occur together. The healthcare provider. Care involving contact is taking place. Definition of patient's environment. Note, the patient environment may differ in some settings. Your 4 moments for hand hygiene. Clean your hands when entering before touching the patient or any object or furniture in the patient's environment. To protect the patient/patient environment from harmful organisms carried on your hands. Clean your hands immediately after an exposure risk to body fluids, and after glove removal. To protect yourself and the healthcare environment from harmful patient organisms. Clean your hands immediately before any aseptic procedure. To protect the patient against harmful organisms, including the patient's own organisms, entering his or her body. Clean your hands when leaving after touching patient or any object or furniture in the patient's environment. To protect yourself and the healthcare environment from harmful patient organisms. Can you identify examples of this indication during your everyday practice of healthcare? Some examples may be shaking hands, stroking an arm, helping a patient to move around, get washed, giving a massage, taking pulse, blood pressure, chest auscultation, abdominal palpation. before adjusting and for rate. Can you identify examples of this indication during your everyday practice of healthcare? Some examples may be oral/dental care, giving eye drops, secretion aspiration. Skin lesion care, wound dressing, subcutaneous injection. Catheter insertion, opening a vascular access system or a draining system. Preparation of medication, dressing sets. Can you identify examples of this indication during your everyday practice of healthcare? Some examples may be oral/dental care, giving eye drops, secretion aspiration. Skin lesion care, wound dressing, subcutaneous injection. Drawing and manipulating any fluid sample, opening a draining system, endotracheal tube insertion and removal. Clearing up urine, feces, vomit, handling waste, bandages, napkin, incontinence pads, cleaning of contaminated and visibly soiled material or areas, bathroom, medical instruments. Can you identify examples of this indication during your everyday practice of healthcare? Some examples may be shaking hands, stroking an arm, helping a patient to move around, get washed, giving a massage, taking pulse, blood pressure, chest auscultation, abdominal palpation, changing bed linen, perfusion, speed adjustment, monitoring alarm, holding a bed rail, clearing the bedside table. Activity, view training DVD, main menu, training scenarios 4A, 4B, 4C. Hand hygiene and glove use. The use of gloves does not replace the need to clean hands. Discard gloves after each procedure and clean your hands. Wear gloves only when indicated, otherwise they become a major risk for transmission of organisms. Your 4 moments for hand hygiene. Measuring hand hygiene compliance. Auditing hand hygiene compliance by healthcare providers provides a benchmark for improvement. The results of observational audits will help identify the most appropriate interventions for hand hygiene education, training, and promotion. The results of the observational audits should be shared with frontline healthcare providers, management, and hospital boards. Method of observation. Direct observation of hand hygiene practices is done by trained observers using a standardized and validated audit tool. The observation is based on the 4 moments for hand hygiene. The observer conducts observations openly, but the identity of the healthcare provider is kept confidential. No names are attached to the information. Each observation session is approximately 20 minutes. Who is observed? All healthcare providers working with patients or in the patient care unit may be observed. Observers will only record what they see. Methods of feedback. Data is collected, analyzed, and reported back to each unit. Hospitals may choose to provide immediate feedback to healthcare providers using the on-the-spot tool. Optional on-the-spot feedback tool. Your 4 moments for hand hygiene. No 20-2025 2001 JKR. Your 4 moments for hand hygiene on-the-spot feedback. Moment being observed. 1 before initial patient/patient environment contact. 2 before aseptic procedure. 3 after body fluid exposure risk. 4 after patient/patient environment contact. Hand hygiene method. Rub, wash, mist. Other considerations. Incorrect nail length, gloves without cleaning. Contact time less than 15 seconds. Moment being observed. 1 before initial patient/patient environment contact. 2 before aseptic procedure. 3 after body fluid exposure risk. Hand hygiene method. Rub, wash, mist. Other considerations. Gloves without cleaning. Contact time less than 15 seconds. Contact us. For more information, please contact Hand Hygiene at oapp.ca. or visit publichealthontario.ca/jcyat. Discussion.